I'm very happy that I'm here today, joined by our trusted colleague and partner, Jon Wilks. He's the CEO and Director at the Institute of Health and Social Care Management and the Director of UK HealthGateway. Thank you very much, Jon, for joining us today. But to put it into context, why are we doing this webinar right now is, and one of the reasons is, we as an office in London, we are regularly getting inquiries, emails from Austrian medical technology companies, companies working in the healthcare sector, on the market, on the UK, and this is the reason why we've set ourselves over the next 12-24 months a series of events, of workshops on this topic. We want to provide information to you, we want to support you on your market entry. And we're starting off with this webinar, and also I have asked Jon to put together an update, the most important information for Austrian companies who are that are trying to enter the UK market. You see kind of the table of content of this report here. This has just been finished, and we will send you the reports in the next upcoming days via email as well. So this will be your lecture, your documents to delve into. But today already we want to not cover all of these bullet points, but most of them, the most important ones, with Jon, with the author of this report, and also get to know, of course, your pains and needs, and we'll try to answer all the questions. So this is kind of setting the scene. We will talk about the NHS, we will talk about the British healthcare system, how the system works, how you evaluate your products, the regulatory requirements, reimbursement, and so on. So this is kind of the topic for today. Just before we delve into it, a very quick event outlook. There's 2 events coming up in the healthcare scene and sector in the UK. The first one, we are part of this as a cooperation partner together with our colleagues in Styria. The ECS Steiermark is involved in a project called Desire. It's co-funded by the European Union, and what they are planning as part of their project is an incoming mission to the UK. So they call it the Desire Trade Mission UK, with a focus on e-health solutions. So this will happen in April, from the 23rd to 25th. So it's a 2-3-day program in the UK, where one of the main focus areas is on B2B networking with other companies. And we will also delve into the UK healthcare ecosystem and visit the Digital Healthcare Show in London. If you're interested in this topic, if you're in the e-health sector and would like to know more information, feel free to get in touch with our colleagues in Austria, with Lisa Maria Katornik. The email address is here. We will also put a link in the chat with more information, and where you can also register in case you would like to attend. The second event is that we are planning as Advantage Austria, is a kind of a follow-up or next step to what we are doing today. So today is kind of the introductory session on the UK and the NHS and the National Health System. So what we are planning to do is, once you're getting a bit more familiar with the market, in November this year, so the date is to be confirmed, we would like to invite you and Austrian companies that have already a product working for them in Austria, maybe in the DACH region, and are interested in in entering the UK market, to give them the opportunity to pitch in front of decision makers and also get some valuable feedback from them. So this is also will be done with our support, with the support of Jon. Very grateful for him, and getting ready for the UK market is also the topic, the main theme of today. So I would like to hand over to you, Jon, for the next 20-25 minutes. And for the second part, so please already put questions into the chat box. We would like to answer all of your questions. So that's it from my side. Jon, thank you very much again for joining us today. It's always a pleasure. We've been working with you for many, many years. You've been helping Austrian companies quite a lot. So it's a pleasure to also hear from your experience and also how, if there's any new companies that haven't been in touch with us as an office or yourself, how we can best help them getting ready for the UK. Thank you, Jon.
Peter, thank you very much indeed, and welcome everybody to this webinar. I don't want anybody to feel alarmed and worried that they may be in the wrong sector. I do brew my own beer. You can see evidence of this here and there around the kind of place. This is not a Forenburger or a Rosa export or anything like that. It's just a bit of homebrew beer. I just want to make sure that we can get off to the right start here. Well, look, this is really about how to enter the UK National Health Service. And the first thing I would want to say is that UK means 4 different countries. Yes, here we do have a devolved approach to government. So there are government in England, Wales, Scotland and Northern Ireland, and they all have their own approach to delivery of healthcare through the National Health Service. It's worth pointing out that the National Health Service is not new. It was founded by a man called Aneurin Bevan, and you can see him here, and in 1948, so just after the Second World War. And you can see him, this was a very famous photograph of the time. This was a young girl, and she was the first patient for the National Health Service. Before the National Health Service came in, people would just have to pay if they wanted to visit a doctor or receive medical attention. In 1948, what the new NHS Act did was to create healthcare for all British citizens that is free at the point of access. It is entirely taxpayer funded, okay? It's worth, I think, at this stage saying, well, so where are we now in 2024 versus where were we in 1948? There are a number of really important things going on right now. I think that it's important for you to have just in your mind for when you're considering entering the UK markets here. So the number one is workforce. Would anybody like to speculate how many people work within the National Health Service in England? Feel free to put it in the chat and Peter can call it out, or you may just want to unmute and shout out. How many people do you think work for the National Health Service? Everybody's a little bit shy. All right, shall I help you along? The correct answer is 1.3 million people. 1.3 million people work for the National Health Service, either in a clinical or a non-clinical role. By the way, 1.6 million people work in delivery of social care. So that would be care that you receive in your home or in a residential or nursing environment. Workforce is a huge problem here at the moment, as I suspect it is in Austria, because we are short of qualified workforce. We have at the moment about 8% vacancy rate amongst doctors and nurses, and that's causing all kinds of issues for delivery of care. The second thing that I would suggest is the way ahead is around digital and technology and the efforts that the UK is making towards making itself more digital and technology led in approach to healthcare. More on that in a moment. We are using data, and particularly population health data, far more actively than we were in the past. And one of the things I do want to just major on with this slide is this piece here, social care integration. In the UK, healthcare is free at the point of access via taxation. If you need social care, that's maybe if you're a little frail or elderly, or you're in need of some support living at home, rehabilitation, stuff like that, that would come under social care, and that is means tested. So if you've got money, then you will be required to pay for your care. If you don't have money, then that will be picked up by local government. It is not part of health delivery according to this budget, but in the long-term plan that was published back in 2018, efforts are being made to integrate health and social care, but their budgets are still separate. Okay, let's move along. I thought it was worth just explaining first of all, how the money flows through the NHS. So yes, this is government taxation, and yes, actually health, the Department of Health and Social Care receives the biggest percentage share of all of the government taxation that is received from citizens. What the government does every year is it allocates a specific sum to health and social care, which is voted upon in the House of Commons by government, and then that whole sum goes to NHS England for it to look after citizens. NHS England in turn distribute that money to 42 what are called integrated care systems. These are regions all around the country, and they all receive an allocation of that global sum. Social care is not included in that, and nor is dentistry, which by and large now is principally privately run here in the UK. So if you've got a dentistry based product, please don't be listening to me when I'm talking about health here. It's very differently organized at present. Okay. What I want to do is just help you to understand the scale of what you're getting into if you do decide to try to sell to the NHS in England, because it has a £185.1 billion annual budget. That's a lot of money by anybody's standards. The current gross domestic product, GDP, spent on health is 11%, and 37% of that 185.1 billion goes on workforce, principally salaries, pensions, that kind of activity. What I've tried to do is break down where all the money goes to. I'm not going to read all of these different things out to you. You can see them here. Things like the integrated care systems. Acute trusts is what we call hospitals. Acute specialist trusts are things like community-based hospitals, mental health, community providers, ambulance trusts who actually run the ambulances, obviously, and we have something around 6,400 GP surgeries. What I'm wanting to do over here, I don't want you even to look at it. What I want you to do is look at it and go, it can't be that complicated. It is the painful truth I'm obliged to tell you. It really is that complicated. The structure here from 1948 to 2024 has gone mad. I can't imagine that Anara and Bevan could ever have dreamt that delivery of healthcare to its citizens would have become quite so complicated nearly 80 years after its founding, but there we are, it is. Here we go. Let me take you through some other stuff. Some of you will be interested in how you go about preparing your product, device or service for regulatory compliance approval, particularly now the UK has taken the ridiculous step of exiting from Europe through Brexit. You can tell I am no fan of Brexit. I think it's been a complete disaster for Britain, and God willing, one day we might come back and try to make friends with you all again. But for now, we're relying on doing our own thing. And as part of that, yes, we've had to break away from the CE system, and we have created our own regulatory medical device system here in the UK for compliance. That is a hyperlink. So when you get these slides, you'll be able to click on that. If you get the reports, you'll be able to click on that. That's hyperlinked. It will take you straight through to the government's guidance on medical device regulatory approach. The key bits of it are, number one, you will have to register your product, device or service or system with the Medicines and Healthcare Regulatory Authority, MHRA. And as part of that, if you have a business that is outside of the United Kingdom and you're going to be exporting products to be sold here, you will have to appoint a responsible person here in the United Kingdom. This is covered by the UK MDR 2002 regulations, and part of that, very similar to CE, is that your device, product, system will have to apply to a specific classification of what you would know as CE. Over here we would know as UK Medical Device Regulatory. Okay, I'm not going to go through this in detail now. We do not have time. As I say, that is a hyperlink that I could take you through, but we don't have time right now. The next thing to talk to you about is reimbursement. Reimbursement is the process by which, certainly in Austria, when clinicians prescribe product, they get paid by the government for having done so. Here, it is absolutely not universal. Indeed, the only products that reimbursement would apply to is those that are prescribed by a GP in primary care, and they become the ownership passes to the patient. So that would things be like dressings, bandages, swabs, and so on. Yes, GPs do get reimbursed for those, but not through hospitals and so on. For hospitals, they just get given their annual budget and they buy their products through that annual budget. If you do want to find out about whether and how your products could be reimbursable, then that is the product, the drug tariff, which is published, I think, bi-monthly here in the UK, so 6 times a year. In there, medical devices and products and systems come under part 9A. And again, what I've done in the slides and in the report is to create a hot link for you through to the NHS Business Services Authority website, where you will be able to find out all you need to know about how to apply for reimbursement should you believe that your product requires it. It's worth talking to you about pathways. So the way that you sell your product in Austria, I can tell you now, it is going to be different over here, as you would expect. Some of the really important things for you to look at would be things like the NHS long-term plan, which was published in 2018. It's really coming to the end of its useful life, but that has set the agenda for the National Health Service's priorities over the last 6 years, and will continue to do so until a new one is created. So you really ought to Google it, NHS Long-Term Plan 2018, have a look at some of the key characteristics there. You'll very quickly pick them up, and that will offer you a fantastic guide in respect of where the NHS's priorities have been. The other thing you should have a look at, again, Google it, is the NHS Digital Transformation Directorate, particularly if you're involved in things like apps or medical device systems or patient record systems, anything to do with electronic registering of patient data and that kind of stuff. The NHS has a really open door for digital transformation activity, and you would find that if you Google the NHS Digital Transformation Directorate. The next thing is we have a lot of national pathways for any kind of thing you can consider, like cancer, stroke, heart disease, kidney disease, liver disease, mental health, and so on. All of these have NHS national pathways that even the most casual Google search, you'll be able to bring them all up. Most of them are fairly up to date, typically 1 or 2 years since they're published, and they tend to get republished every 3 to 4 years, something of that nature. If you're interested in how your product might be assessed and evaluated by the NHS, then there are 2 key things that I think perhaps you ought to look at. Number 1, and again, there's a hot link here, is to the National Institute of Clinical Excellence, the acronym there, NICE. If you have a look at that, the National Institute for Clinical Excellence, they have programs whereby they evaluate products and systems, and then they will assess whether these are good value for money, good at outcomes, or not. If you have an app-based technology, via your phone, something like that, then the only game in town really is an organization called Orca. And again, there's a hot link there for you. And Orca is an organization devoted to evaluating medical device apps to ensure they are safe and they deliver on what they promise to deliver. Both of those organizations, well worth having a look. And if you're interested, this was my family a few years ago, and this mountain is Cwnag in the Scottish Highlands in the Assynt mountain range. If anybody does get the chance, if you do come over to the UK, see if you can get yourself up to Scotland. It will blow your minds. Here's the next thing that you really ought to be across, which is the importance that the NHS today places upon data. The NHS has taken a really granulated approach to data in the past. Individual hospitals, mental health trusts, social care providers, community providers, even primary care providers, all buying their own electronic patient record systems and messing around, trying to do their own individual things. As you might imagine, that has caused the most awful mess where nothing links up with each other. And if you're a patient going around the system, you might well have to repeat yourself multiple times, just endlessly giving the same information. The good news is a new NHS federated data platform has just been announced, £170 million investment in that, and that is being rolled out over the next 3 to 4 years. The other thing you should consider is economic modelling, and that is basically proving how your product either saves money in a local level or how it improves outcomes and thereby delivers financial efficiencies. We are really hot on that, and you can absolutely expect to have any data that you submitted to scrutiny, and you may well be, if you tell fibs there, you may well get caught out further down the line. Okay, you will absolutely need to provide some UK-based evidence of your product or system's efficacy before you can expect to sell anything within the UK NHS system. Okay. Next thing along is the importance of a business case. I cannot stress enough how important it is for you to gather information, data, feedback, pathways, key opinion leader opinion and so on about your product or system here in the UK, and you create a business case environment whereby you feature that and allow the NHS to evaluate what they have. It's one of those things you're just gonna have to do it. You're basically trying to prove that your device either saves money or improves outcomes or both, but you need to do that and be able to provide evidence at a really local level. The good news is that in the report, there is a template advising how that can be done. Okay.
But starting off with one of the most frequently questions that we get is, again, on the aftermath of Brexit and all the changes in regulations, and you've mentioned the MHRA, so this is kind of the new medical health regulatory agency where every product needs to be registered. Is it necessary, or to what extent is it necessary to have a physical presence in the UK? You've touched upon the UK responsible person, so it sounds like there needs to be someone here. Is it also required or of benefit to have or establish a subsidiary? Can you walk us maybe through 1 or 2 examples on that?
Yeah, thank you, Peter. This is a question, it regularly comes up. It usually starts with, should I try to sell direct by setting up a UK subsidiary, or should I look to appoint a distributor? And of course, it very much depends on the nature of your product or system or technology. Really only you can judge that. My experience is that people tend to have more long-term success if they establish a dedicated UK subsidiary. I know it's cheaper, you might say, to set up a distributor, but the risk you run is that unless you get your distributor absolutely right first time, and unless your distributor is perfectly incentivized to sell the product, actually what a lot of them are very good at is order taking rather than system selling. And that is the big problem, in my view, with going through a distributor, particularly if you have a really innovative product. In my experience, it tends to need system selling. It needs face-to-face. It needs a member of your team who is expert in that regard to come in and convince NHS organisations of the product or system's merit. That's just a personal view. You know, we've got plenty of examples of people who have appointed a UK partner via a distribution or agent agreement, but overall I would suggest the smart money would be put somebody in market, let them make some networks and some key opinion leader contacts and so on, build up your understanding of how you might go about a pilot study evaluation, and build up your business case, build up a contact with MHRA, and then, you know, there's no way that anybody coming in from any country is going to be able to fast track and be able to expect to be easily selling product into the National Health Service in 2 or 3 months. The world just doesn't work that way. But maybe 12 months, 18 months, 2 years, that's a sensible period of time. To be really successful, yeah, to repeat myself, I think investment in a UK subsidiary is the smart move.
Well, then the next question would be where to start the subsidiary. So it's a geographical question that we got here. You've mentioned a little bit the structure of the NHS, and you know, many of the people in the audience might have already heard about the NHS trusts. So there's, I think, more than 200 trusts all around the UK, which are basically geographical organizational units, so which incorporates maybe 3, 4, 5 or more hospitals within one NHS trust. And these trusts, if I understand you correctly, are working more or less independently in terms of the decision-making power on the equipment and so on. So the big question would then be for a manufacturer, which trust to pick? Are there regional differences? Are there differences between trusts in London and Manchester and Birmingham and other regions? That maybe some of them put more focus on innovative solutions, some more on digitals. Can you maybe explain a little bit on regional differences and where best to get an overview and how to start?
Yeah, well, I'll try, yes. I think if what you want is you want profile. So if you go for the big trusts that are very well known, which attract the very best clinical staff and the very best innovations and money and systems, you know, somebody like Guy's and St Thomas's Trust in London, you know, very high profile, 34,000 people working for it, you know, that's going to give you, if you get in with them, that's going to give you a profile that would be impossible to ignore in the rest of the country. Whereas if you pick a smaller place, the risk you have is it just doesn't carry the same kind of weight, influence, cachet that you might expect from one of the bigger ones. In terms of your physical location, I don't think it particularly matters where you might choose to set up your office. And what you might find is that some of the devolved nations like Wales and Scotland and Northern Ireland may well have grants available to an Austrian company looking to set up in that country because they're keen to grow and attract inward investment and so on, perhaps more so than would be the case in England. And just to put it into perspective, let's say you set up in Cardiff, the capital of Wales, you're only an hour and 50 minutes away from the centre of London on the train. So it's pretty straightforward to get to the big conurbations. You know, Birmingham is an hour and a half, 2 hours away, something of that nature. Pretty easy to get to the big conurbations, really from wherever you choose to set your office up. So the key is not where you set up. The key is who do you interact with to get the biggest immediate impact. And I hope you don't mind me saying, Peter, but because I run the Institute of Health and Social Care Management. You know, we have nearly 8,000 members right across the United Kingdom, including formal partnerships with people like Guy's and St Thomas's and Royal Wolverhampton and Mersey and West Lancashire and University Hospitals Leicester and Health Education Improvement Wales and NHS Education Scotland. You know, we can probably help you to make some introductions there, as we've done in the past with other Austrian companies.
Yes, definitely. The offer stands, of course. Very, very happy for everyone in the audience to reach out to us. We extend the invitation, and Jon, we will also put Jon's contact details in our email address as well, and he has our reference as well that he has been working successfully in the past with Austrian companies, leading the way to various hospitals and decision makers within the NHS. And one question that you've touched upon was grants and financing, and this one Austrian company wrote to us, are there special financial incentives and support mechanisms for non-UK companies as well to get started within the NHS, or if that's not possible and they have established a subsidiary then for UK subsidiaries? So it's especially looking for financial support tools.
Yeah, it again, you would expect me to say this, it very much depends on the sort of technology. So, you know, the door is very firmly open for genuine innovation in artificial intelligence, for example, or in interconnected technology that helps to integrate different care providers. Absolutely, there may well be grants. There's certainly funding available for those things, either directly through the NHS or through academic research institutes and such like around the country who'd be interested in contributing. The less innovative products, you know, consumable stuff, still might be quite interesting and useful, but it doesn't have that digital technology sort of profile. Less grants available there. I think you're just going to have to prove your product's worth in terms of, does it save money or does it improve patient outcomes? But don't overlook, if you are setting up a subsidiary here and you're going to employ people here, don't overlook the fact there may well be grants available either regionally. In England, you won't get grants in London, it just won't happen. You know, they're already full, but regional stuff, you know, less economically advanced regions, or indeed the devolved nations like Wales and Scotland and Northern Ireland, absolutely, there will be a business setup grants available to you. Yeah.
Maybe this is also a good place as a reminder for Austrian companies that the UK now is again part of the Horizon 2020 Horizon Europe, as it's called now, project. So again, if you are already in the earlier stages where you're looking into getting UK data, getting maybe a UK partner on board, this might be also a way to get funding, to get the first step into the UK health ecosystem. Brilliant. So the next question we got was from someone on more the regulatory front. So since we don't mention the B word anymore, but we kind of can't get around it, changes have been, now coming into effect, especially while the EU has been implementing some of the new MDR regulations. So the question was, when, is MDR CE clearance still accepted? How long? What are the changes that are coming up in the deadlines that the companies need to be aware of?
I wish I could tell you, Peter. I wish there was that kind of clarity at the moment. It is difficult. All I would suggest is that you go through the current government guidance, and I've provided the web link for that. Make your MHRA contacts as well, and start to go through that process and allow yourself to be led by the Medicines and Healthcare Regulatory Authority. You know, they're good. They're not interested in making life difficult for people. they're interested in bringing products in that are safe and fit for purpose. And you know, if you can prove that you can do that, it's a fairly smooth process that you will follow. It's nothing to be frightened about. It's not going to cost a huge amount of money either, I don't think, particularly if it's, you know, class 1, something of that nature. But just follow the process is my advice. If people offering you a get compliance quick scheme and that kind of stuff, nah, ignore it. Interact with the MHRA, engage with them. They're good people, they will help you. It's in their interests to help you. They want product coming in that is safe and fit for purpose. That's my advice.
And with that, I would really like to say thank you very much, Jon. I know this has not been easy, and you know, I don't want to you know, stretch the hour and make sure that you are right. And thank you very much for taking your time. We will look forward to continuing our collaboration. Please, if you're interested in the Dragon stand that we are planning in November, or attending the UK trade mission in April with our partners, feel free to get in touch with us. With that, I would like to say thank you everyone for tuning in, for staying with us, and I hope to get in touch with you soon. And with that, wish you a wonderful afternoon, and goodbye from London.